right when I blew my bubble.
I've done all these critical things like assess the patient for pain. I've given the patient an opportunity to go to the bathroom to empty their bladder because once we get started they can't continue. I have given the patient information about turning his head and not coughing, talking, or breathing over the site. Checked my armband, all those safety things I did. Okay, so now I'm just down to the down and dirty of changing a dressing. Whew, you're a nasty man. Okay, one of the things that you need to get aware of, become aware of, is where do I want my workspace to be? Where do I want my sterile field to be? Because I am doing the dressing change here, I like my workspace to be right there because there is no way I can turn my back on my sterile field if I put it here. If I put it down here, which most of you tend to do for some reason because you forget that this is on wheels, then I have a really good opportunity to break sterile technique by turning my back, see? So think about that before you start. Set yourself up for success. Okay. I have washed my hands, and you may not know how it is.
Yes, ma'am.
Taken off my jewelry, well, he doesn't have a dressing on. If he had a dressing on, I would put on clean gloves, and I would remove the old dressing. And I would do that slowly.
That's the quote with Jackson was actually
And
four.
as I pulled that dressing off, I would make sure that I kept the little blue hub kind of under my control because we don't want to accidentally discontinue a central line. Okay? So, pretend. I hate using the word pretend in lab. I think you should always have what you need. But pretend. Here's my dressing. Take my glove off.
And you don't need a mask.
You do not at this point.
When you say keep the hub under control, you can't touch it though, or
You can, when you're taking the dressing off, I touch it as I'm pulling the dressing off, and then yeah, you can touch it.
okay.
You're gonna clean the whole thing and get it all clean, right? Yeah.
Without sterile gloves.
Okay. Now don't have on sterile gloves yet. Okay. And don't forget, always practice Diva Drop. If you don't use the Diva Drop, you're going to break sterile technique. So remember your Diva Drop. Okay. When you open a sterile container, you're going to open it away from you. So, because you don't want any of your scruff from your skin, from your arms, to fall into your sterile container. Okay, now I'm going to take this out. I can touch this, right? Because it's getting ready to go onto a non-sterile surface. Non-sterile, touching sterile makes sterile non-sterile, right? And if Diva doesn't drop well, you just leave it there. Okay, when you're opening a sterile drape, if it is packaged, you should open it following the ABCs. Away. And there is my mask. And I'm going to go in and put it on because I'll get it out of my way. Many hospitals require that the person doing the dressing change and the patient wear a mask as well as anyone in the room. So you have to follow your agency's policies about wearing a mask. I usually try to get the people in the room to leave. It's just a lot fewer germs and breath, floating around in the air. Remember how to put on a no pinching, pressing, okay, away, and next is bottom, and I don't think I'm going to be able to have to do sides this way because it's packaged that way. And even, remember, 1 inch around the perimeter of any sterile field is defined as non-sterile. So I can manipulate this and make sure that I get this to lay down nice and flat, because if it flops back over onto into this area, then I've broken sterile technique. Okay, gloves. See what we got here. These are mediums. They're going to be way big for me, but I can still do it. Sterile, touching non-sterile, non-sterile. You don't have to be afraid of the package the way you were when you very first learned how to do this. When you were afraid of the package? Okay. Following the ABCs away. Make sure you get that little crease kind of pressed down so that it doesn't flip back. Below. And center. You're going to glove your dominant hand first. If you're right-handed, that means you glove the right hand. Left-handed, glove the left hand. So, pick this up. I'm going to hold it well above my waist and away from the other sterile glove. Alright, now this one always is hard to get your fingers underneath that cuff like you're supposed to do. Remember, I can touch 1 inch with my ungloved hand, and I can move this any way I want to as long as I keep it out of that 1 inch perimeter, because I've got sterile touching sterile. Sterile touching sterile is sterile. Have you ever done this? Okay, I can adjust this glove with the palm and the fingers. I'm not real crazy about. Okay, but I can't touch an inch here, can't touch an inch down here. That's defined as non-sterile. Okay, if you choose, you're going to look at your wound, and then you're going to choose what you're going to clean with. If there is blood or dried exudate on the insertion site, you would want to clean with this alcohol and this Q-tip first. Ours is remarkably clean, so I'm just going to put these over here. Drop, don't place. And I'm going to use the chlorhexidine. And this chlorhexidine is, I've got to activate it. I don't hold it here, because if I do and it drips, then that principle of sterile technique referred to as wicking, is where fluid can wick up through. So, okay, and now I'm ready. If you are using chlorhexidine, best practice says that what you do is you clean the line by going, cleaning an area, moving your chlorhexidine in a horizontal fashion, then moving it in a vertical fashion. So we're going to clean, and we're going to go back over and clean. That's because you can do that with chlorhexidine. Okay, now I'm going to go up and down. So horizontal and vertical. Doesn't matter which one you pick first.
So you don't have to go like underneath the
And,
tubes?
well, this piece of tape is not really going to be there. That's just holding this line in. So you would be cleaning all around that site. I just, because that tape is there, it makes it a little hard, but just.
Would you do that before the lines or after lines?
Hmm?
Would you do that before the horizontal vertical or after the horizontal vertical?
I would do that while I'm doing horizontal and vertical. I just went back to do it to make her happy.
Okay.
David drop. Okay. Now, notice I'm keeping my arms above my wrist. you have a little piece of gauze. Okay, I want you to look at how I picked that piece of gauze up. I pinched it from the middle. Do you see that? I'm not touching this part at all, even though my gloves are sterile. You know, steril's a relative term, and I don't want to touch my fingers to the portion that's going to go next to the patient's skin. So, put that on there. And that's going to simulate your antibiotic wafer or that little gauze that has a little slit in it, but you pick it up the same way. You're going to pinch from here. That's the way you should always pick up any dressing material of any kind when you're doing a sterile procedure. Okay? And if I put my trash can here, I do not run the risk of moving something that is dirty or soiled over my sterile field. Can't do it. That's what I mean, setting yourself up for success. And okay. At this point, I have completed my sterile procedure. You need to always know when sterile is done, because that will tell you when you can take off these gloves and mask. Okay? You see that sterile is finished at this point. So I'm going to take my mask off because it makes me have hot flashes. It does. And my gloves. Now, if your Tegaderm does not come with an